Everyone, thanks for joining. We're going to get started now. 30 minutes, one question, one follow-up. And Dr. Williams is here today, so I'll turn it over to him for some brief remarks.
Thank you. Good afternoon. Our counts, looking at this week, how it's been, we have remained above 200 for the last week and above 100 for almost 4 weeks. So over time, we've seen this stepping up to new plateaus of cases that we've experienced. Yesterday, we saw our highest number of cases in a single day since June at 315. Today, we're reporting an increase of 293 new cases. So between this week, we've been averaging around about that 300 number at a sort of a level plateau with some variation slightly above and below. As we said in the past, most of our cases, that's 229 or 73%, and 76% of today's cases, so yesterday and today's is about the same, are concentrated in the three regions around Toronto. That's the Toronto, Peel, Ottawa, and York, and make up that number there. Those numbers, Toronto again today was 77 down from 77 up to 85. Peel was 63 from 54. Ottawa is down to 39 from 61. And York stayed the same at 37. So the cases mostly we see are those under the age of 40, where the age group of 20 to 39 makes up nearly 1,400 of those cases, or 51% of that. So our exposure issues we're looking at here from asking our medical officers of health and from our data entered into our system seem to be trending in certain directions. We still see some workplace outbreaks, and we're monitoring those and observing those. We're seeing mostly large family-type gatherings or private gatherings, including some of the wedding after ceremonies such as receptions. And they have been contributing to our outbreaks and our numbers in that regard. The workplace infections, I said, are there. We have been monitoring our restaurants and bars because people have a concerned interest in that regard. We've noticed that there are some cases related to those. They've been primarily among the staff and seems to be staff-to-staff transmission, especially, I would say, when they're not in the dealing with the patrons, more in contact with each other in after hours or other times. So not being as strict and conscientious in those after hours as they are in working with the patrons or the customers coming to their facilities. So we'd ask them to increase that vigilance both on and around the job to ensure lack of spread among their fellow workers. The outbreaks in long-term cares homes continues. While a lot of them are the one case and is ruled in, ruled out fairly quickly, we have had some significant ones in the Ottawa area. And we continue to monitor that and work with our partners in Ontario Health, as well as, of course, working with our consultation with Dr. Heyer in his role of a provincial coordinator, as we seek to deal with Ottawa Public Health, assist in that matter. So it's a team approach to bring those ones under control as soon as possible and to limit any further outbreaks in that area. Of course, it's back to school time, and we've had a lot of children going back to school. A number of the boards are now nearly getting back to full return. Some are still doing the virtual, and some of the secondary schools are still pending in some areas. And we've also had the return of post-secondary students. I don't mean the international students, I mean the ones that are traveling to campuses to either go back into residence or in their own living situations and resume classes. A different reality for them. A lot of the classes are virtual. Nevertheless, we've seen some clusters of cases and individuals who in their probably first few days or first number of days back at the campus would seem to have let down their guard a bit and have had some events and activities. Fortunately, we see a lot of them getting tested, which is good, and we've seen some clusters and outbreaks in that. Western University, for example, and we know that the medical officer of health at the Middlesex London Health Unit has declared a community outbreak and concerns about those cases. The university itself has reported well over 20 cases related to their institution that they're either in quarantine, investigating, or following at this time. In schools, we continue to see the data looking interesting there. The Ministry of Education has noted so far of all the many cases of people going back, that's staff and teachers and students, a total of 62 related COVID-19 cases in Ontario. When you consider the large number of people we're talking about, while that is a significant number, it's still reassuring that it's not much larger than that. Most 20 were students, 22 staff, and 20 individuals were not yet identified, still being investigated. And some of those actually were contracted prior to school starting and ended up testing positive in and around the time they resumed some duties at their institutions. But fortunately, many of them were related to using proper PPE as well as distancing and other public health measures. So of the 51, there's 51 schools that have been affected by these cases. 44 were ruled out fairly quickly with only one case, and the other 7 are being monitored. We have one school, that we've had our first outbreak related to a school that is in the Renfrew Health Unit area, Pembroke specifically, and we've had some staff there testing positive where there's some concern by the medical officer of health that there might have been some potential ongoing transmission to a wider group. So they're doing some, I would say, intense monitoring, testing, and investigation. So they hope to be able to make some determination about the school, whether it can open up again or large parts of the school can open up again by early next week, but we have to wait until the local medical officer of health, their staff, their public health nurse, as well as the school administration have completed their investigation to ensure that things can open up again quickly and efficiently. And this emphasizes what we've been talking about all along. We're trying to set up this infrastructure, not saying that we hope we don't have any cases. We're expecting some cases. We'd like to keep the number down low like it is at the moment. We'd like to keep it there and even lower if we could, but we know there will be some. We know there'll be some that may be some potential outbreaks. There may be some defined outbreaks. That's where we have our public health officials. We have our public health nurses. We have the teaching staff as well as the administration staff set up to prepare to respond to those quickly, efficiently, and effectively, and making sure we're trying to improve our communications out to the parents, to the other students and teachers, as well as to the public writ large, so we can get a sense of how is it doing, how are we doing, and how is our function on a go-forward basis. So we have an abundance of caution taking place at this time. As I said, some of the municipalities that have had schools in them, there's a wide range from around the province. Toronto, 7, Oakville, Pickering, Mississauga, Brampton, Markham, and Ottawa, more in the southern Ontario area. And as I said, because some of the health units in the north, for most of the time we've hardly seen any cases there, or less than 5 in a lot of the health units. But we noticed earlier with our press release talking about some of our high hotspots, namely in Ottawa, Toronto, and Peel District. So again, while we see these numbers up, we've seen large numbers of people coming forward to get tested, and we're seeing the effects of that. We have over 35,000 tests done today. That's remarkable with a 1.3% positivity rate. So we've seen that evidence with the lineups at different assessment centers, variations within the province depending on the zone and area. But it tells us that we're not out of this yet. And as the Premier noted, and we emphasized at our presser at 1 o'clock, this tells you that COVID is still here. We have a lot of work to do. We have to stay focused on the task at hand. We can't take our eyes off the target. We have to keep doing our distancing, wearing our mask where we can't maintain the distancing for a few minutes, hand hygiene, staying home if you're ill. If you think you've had contact or significant, or you have the signs and symptoms of COVID, to get tested in that matter. And so we still have to handle that. We're trying to keep our social circles down to 10 still. And I think there's some confusion out there between social circles and social gathering. It's probably a confusion that we had social in front of each one. The circle is the close family friends that you have been in a cohort or bubble with for a period of time, that while you're with them, you don't have to do the distancing, the masking and hand hygiene, but you have to keep each other informed that you're going to be vigilant and careful with your contacts outside that circle as to not put the group at risk. And if you have, then you're going to inform them and get tested and advise them accordingly. The social gatherings we've talked about, whether it's the 100 outside and the 50 inside in most of the province at the moment, or the new standard we announced today of the 25 outside and 10 inside in Ottawa, Peel, and Toronto, means that while you're going to have that together, it's not a circle. You still have to do the 6-foot distancing. You still have to wear the mask in that because they're not part of your cohort. And you have to take precautions accordingly in those settings. And those who are having those type of activities have to ensure that there's adherence to those standards and practices. So let's be clear on what the difference is between a gathering versus a social circle. And we know that many people have close contacts of cases that there's confusion about that too, is that when you have a contact with a case that you have to then isolate and monitor your symptoms during that time. You may have to get tested as you develop any signs or symptoms, but you have to maintain that for the 14-day period if the person was identified as a case and you've had a close contact with that case. So you have to follow the same rules we've done all along. You may want to look back at those and refresh yourself, as people may have forgotten about that, and they get their notice on their app and their COVID alert, and they wonder what to do with that case and how to handle that. So a lot of things to remember. We're in a busy time, and there's lots happening, and people have to keep focused on different ones. And I know it's getting confusing because we're talking about outbreaks here, we're talking about schools, we're talking about universities, we're talking about testing, we're talking about social circles, we're talking about social gatherings. So it's just like that any time this time of year, when without COVID, when people return to activities, you often hear about the family unit saying, we've got children in these 4 activities, this going here and there. It becomes a real task to keep this organized, and you have to keep these numbers organized in your mind. And we have those sources at our web pages and that, so you can apply yourself to those, look at those, understand the context of where is the risk in your area and what do you need to be aware of that's happening in your jurisdiction, your school, your university, or your children, or your family members and your social circles. So stay focused, stay on target. I think this number of increase and rise here, which is not surprising with all the people coming back into the system. I think by doing that and doing it carefully, I believe we can flatten this current rise again, because we've done it before. We can do it again if everybody stays focused to the task at hand. And we've done it, so I have full confidence you can do it again. So with that, we're going to open up for questions from the media.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question.
First question comes from Christopher Herhart from CP24. Please go ahead.
Hi, Dr. Williams. I spoke to a woman in Mississauga today who waited 6.5 hours in line for a COVID-19 test. Is this acceptable, and is it not probable that these lineups are discouraging people who should seek a test from actually getting one, preventing them from being traced, isolated, and counted?
Thank you. That's a good question. And as the Premier noted back about a week ago, we didn't see big lineups, and in a few days it just ballooned out. And do we want those big lineups and people waiting that long? No, we don't. We would prefer that they were shorter and people could work through it in a very timely fashion. I think it's important because I said we have a surge at the moment with students returning to university who might have been exposed and been notified that they have to get tested. There may be some ones where related to school issues, they've been asked to go and get assessed, or they've decided to get assessed. As also there's some related to long-term care facilities that are in outbreak modes that need to be assessed as well. And there's ongoing alerts from their COVID apps and that aspect. So I guess my direction on this one here, we're trying to work quickly to get more assessment sites up and running. Well, this may be a surge at this moment as people are in a change of time, a change of venue. They moved out of the summer into the fall plan. So much like at Christmas rush shopping, there's people that need to be there, there's people that's good to be there, and there's some that are just also there that it's not as urgent. And I guess my request, much like we say when we come to flu season, not far off, we ask people to get vaccinated, we ask people to do the proper cough etiquette, hand hygiene, stay home if you're sick, because we ask you to do that because you don't get ill and then overload the emergency department. The same as we're saying here, if you don't need to be seen right away urgently at this time, if you're getting tested because it's something that you might have wanted to do, you have not a contact with the case, you're not being doing it to undertake an investigation of an outbreak, you don't have signs or symptoms of COVID or applicable to COVID, or your COVID or COVID alert app, sorry about that, then you may want to defer your visit, if it's not urgent, until the lineups decrease again. I think this is temporary at the moment. Nevertheless, the government and the minister's announced he's working assertively, and we are, to open up more assessment centers, especially in those areas of high demand, to make sure that those who need to get seen will get seen. At the same time, we want to make sure the essential testing gets done, and we don't want to overload it with ones who are just interested in having testing, because we not only want to get them tested quickly, we want to turn around those test results and get them back to you quickly. So we want to make sure we can keep within our time frame of seeking to get them back within 48 hours. But we know there are reports of people waiting a number of days, and we're not satisfied with that. We'd like to improve upon that and our system there. So everybody, if we could all take part in this, work through this current surge We'll hope to improve and make sure that we can drop those lines down and still get everybody tested who needs to be tested, when they need to be tested, and get the results back as soon as possible.
Follow up?
Backlog of unprocessed tests now stands at 37,000, more than our labs have ever been able to keep up with during the entire pandemic. So what are we going to go do differently over the next 2 weeks while Mr. Elliott says the capacity in the system will slowly be increased?
So, as I said in my first answer, I think we're seeing the current increased demand at this moment. I think when that works its way through, that there may be decreased demand. There's a number of people that are interested in doing some other purposes of testing that are not urgent or required. They may want to consider delaying a bit so they don't have to wait for 3 or 4 hours and decrease their presence in it, so allow those who really need to get tested quickly and timely. At the same time, we're looking at some more centers opening up. As you noted, this number of over 30,000, 3 weeks ago we were not getting that. As you remember, sometimes on the weekend we dropped down to 17,000. We did not drop below 25,000 or 23,000 this whole past week. That's new for us. And this week we've had many days over 30,000. We have not seen that either. So we have an increased public demand at this time. And as the Premier said 2 weeks ago, a week or so ago, he didn't see the lineups. This all of a sudden appeared. And so we have a sudden surge at this moment. What are we doing about it? Well, I'm asking people to pace it out a bit, but I'm also asking, and the minister's checking in to see what we can do to increase our capacity in testing sites and locations to keep this number, if we need to keep the number up, because if they need to be tested, we want them tested. We want them tested in a timely way, and we want the results back in a timely fashion to advise them and so they can take steps, whether they're dealing with a workplace problem, school problem, university problem, or a family issue. They need to know, and they need to know in a timely way and in the right way. So we got to make sure our system can handle the load.
Next question.
Next question comes from Marcy Cutler from CBC News. Please go ahead.
Thank you, Dr. Williams. Further to your reference about the flu vaccine, what is the plan for rolling out the flu vaccine this year?
Yes, there's been lots of planning going on that. Some people think it's mostly just COVID all summer. It's been even starting in the late spring to summer. We've been doing intensive planning with our people who are involved in running out the Universal Influenza Immunization Program. It's a long acronym we've had for many years here in Ontario. We have ordered more vaccine than ever. As the minister noted, we actually ordered more high-dose vaccine, different types of variety of vaccines. So those are all been in the hopper coming in. We hope to get the delivery from the companies soon. They have to work through their timelines and their process, their lot testing. So there's formal things to make sure that if there's going to be a vaccine, it's timely, it's effective, and it's safe. And we do not want to compromise on that. So when those vaccines arrive, we're going to do our usual methods. That means distributing out to primary care physicians equal to their amount that they had last year. We're asking our pharmacists to step up and do even more. We're giving them even the right to do the high-dose vaccination for seniors over the age of 65. So that's been added to, so we're enhancing that program. So we're doing a number of areas to really pick up the pace on that. So we're ordering 18% more vaccine than we even had last year. So last year was a record year. We're assuming they're going to have a demand, and we want to cover that. So we want people, if and when we're ready, to roll it out. We always start out with our high-risk settings, long-term care homes, those over age 65, those with health conditions and comorbidities to get done first, and then we cover all the rest of the population. So a lot of work ahead in the middle of a COVID season, but we think, again, we're going to be up for it, we're ready for it, and we want Ontarians to be ready for it, and our partners and our stakeholders around the province. So we'll give announcements and updates as soon as we have that available and start to roll our program, our UIIP for this year, out fairly shortly.
Follow up?
Yes. Have you told the doctors or been in contact with many doctors about the plan that you're getting? We're hearing from some doctors that they really don't know what to expect from the government this year.
Right. So the communication needs to be clear on that because this is now a program in the COVID season. So they have questions about PPE in their practices. We have consultation at our command table with primary care. We're working with the Ontario Medical Association, the various colleges and that. So the fact that some may not know that for sure, then we got to improve our communications and get that out ahead of time so that if they're planning to have it in their practice, whether it's solo, group, or different organizations and structures, whether it's primary care, whether it's nurse practitioners, or whether it's specialist pediatricians, we want to make sure they're advised and aware and have their questions answered before the season starts. So Work is not over yet. We have much more to do, and we hope to get that out and to clarify those questions as soon as possible.
Next question.
Rob Ferguson from the Toronto Star. Please go ahead.
Hello, doctor. I'm wondering what kind of tests will be being performed at the pharmacies when that all gets rolled out. Is it going to be the same PCR test that people get at the hospital-based assessment centers, or some other kind of test?
We've been looking at in Ontario here about beyond the standard nasal pharyngeal test. That's the long swab that goes in the back of the nose. We've been doing some assessment with Public Health Ontario in the laboratory system, and we have systems called an Anterior nasal swab, which is more like a typical swab, throat swab, and there's fancy terms like mid-terminate and that. So they'll probably be using more of those methods and technologies because it's easier to administer and less invasive on that level, and yet the performance, as far as we can tell, is pretty close. So we're going to be looking at a variety of different testing that may be utilized also by some physicians in their primary practice, so a wide variety of places to get tested. So the methodology is going to be slightly different, but it still is PCR. So we haven't moved to other technologies yet. We're looking at the ongoing studies around saliva and methods on that. So those are being undertaken. The point of care testing, we have some samples of those we're looking at as they're released by Health Canada and as we get the supplies and the products up from those new companies. But those are more for areas that need point of care testing, especially in our northern rural remote areas that have difficulty with transportation of samples.
Follow up.
Okay, thank you for that. And in terms of moving forward, it was just a month ago you were talking about maybe letting people have more than one bubble or a bigger bubble, and now we're sticking with the bubbles. Do you see a point, or what point would it be, where you would have to yank back the whole social circle, social bubble concept?
So that's a good question, Rob. We've kept the social circle at the 10 at the moment because in essence, while that's at 10, if you look at function, what we've done, especially those who are parents of children, they have now their children involved in new cohorts or bubbles, if you may, in their class or group setting in the school. So if your child's in grade X, then that child in that group is part of that one. It may be a different group number than 10, but they have that one. So your parent is understanding they're going to have to maintain vigilance and to inform the school so they can inform that cohort if there's a problem with your child or health issue, if there's testing needed, etc. So the same type of trust and confidence you've done with your own social circle, you're going to maintain that. The question we're asking ourselves is trying to increase or improve the confusion that seems to be out there where people assume that a social gathering with, in some settings, 50 indoor and 100 outdoor, some now the new 3 with 10 indoor, 25 outdoor, that they can do those the same as a social circle. That's not the case. So our public health measures table has been concerned if we change too many things all at the same time, we'll add to the confusion. So we want to make sure we stay with the one circle at the moment. Nevertheless, you have already involved your children in other cohorts and groups similar to circles and bubbles, if you may, with their fellow students in that class or cohort with the teacher. So what we haven't officially is unofficially that's what's happened, and that's the functionality we want to have. And it's have the same vigilance, care, and caution of not exposing your child to other contacts outside, so when they go into their class or in their cohort in their bubble in the school, they can do so with the confidence that they and their fellow parents have maintained that protection for the I would say the vigilance and confidence that you would do in the school as you've done at home.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Hi, Dr. Williams. Wanted to check in with you today about an interview we did with a medical officer of health near Ottawa who says there's such a backlog at the labs up there that some of the samples that are being taken are expiring before they're tested. And that's obviously hindering public health investigations and effective contact tracing. We're wondering if this is a problem that's just happening in Ottawa, if you've heard of it happening elsewhere, and if you can speak to what's being done to address it.
So we're working with our lead in Ontario Health that has the assessment centers in that jurisdiction. We understand there is some logistical issues locally. They're trying to address that. I had not heard about the expiring of samples at this time. Certainly we'll take that back and check into that. We have heard about long delays in getting results back, and that's not acceptable. And I know that Ontario Health is trying to address that because they not only have some logistical, I would say technical issues they're trying to work through in that area. They also have a large amount of people coming forward to testing because of the amount of cases they've experienced in Ottawa, both in relationship to some of the long-term care facilities as well as in community cases. So they have both a load issue as well as some laboratory logistical issues that they're working through, and we understand from Ontario Health they're trying to address those in a post-haste way, but we'll pass on the concern and issue about expiring samples. We hadn't heard that yet.
Follow-up?
Thanks, Dr. Williams. By way of follow-up, I wanted to ask you about the pharmacy testing plan that the province sounds like it's working on. Do you have any concern about there being any additional risk of community spread at pharmacies where, you may have people who are COVID positive going into these pharmacies, getting a test, and mingling with patrons in the pharmacies, seniors who are there, you would imagine, to get prescriptions renewed, for instance?
Yeah, that's an area, it's a good question. It's one where I have concern over, and we have concern in that matter. What we're trying to get the details of how that testing would be undertaken by pharmacies per se. Some areas we've looked at is where we'd ask people that are that do not have symptoms. So we don't want people who are ill going to the pharmacies. So we're going to make sure that's clarified when we put out a direction. So the program has not launched yet. It's going to be soon, and we want to have those parameters in there because, like you have noted, we don't want to be the pharmacies being sources of outbreaks within the community, especially with vulnerable people going there. Not only, you mentioned getting prescriptions, but of course, as I said on a previous question, an answer I should say, they're going to go there for their flu vaccine. So we want to make sure we're not at odds and putting people at risk. So these kind of details, as you've alluded to, are important, and we want to make sure those are clear before we launch that program.
Next question, and this will be the last question.
Last question comes from Cynthia Mulligan from City News. Please go ahead.
Hi, Cynthia.
Hi there, doctor. Sorry, I had to take you off speakerphone. I apologize. I'm just wondering, the mayor of Markham is quite concerned of York Region is quite concerned that they're not being added as well, and they would like to be a part of this discussion and have the lower caps. What do you have to say to municipalities, other regions that haven't been included in this but want to be? Why wouldn't you include another region if the mayor has requested it?
So that's a good question, and I was asked about that at the 1 o'clock presser and saying that at the moment with our public health measures table and with the data we have, and in consultation that the premiers had with the mayors of those three areas, as well as with our consultation with the medical officers of health, Dr. Etches in Ottawa, Dr. Davila in Toronto, and Dr. Lowe in Peel, know that they have seen a lot of transmission. Their numbers are the highest. As you've alluded to, York Region has bumped up in the last week or so with some more cases. I've not heard from the medical officer there yet that he would like to recommend going that way. That's something that our public health measures, as I said at our presser at 1 o'clock, we will review other regions as the data comes forward in consultation with the medical officer of health, where their assessment of their situation, where they would be wanting to recommend that they would go to the more restrictive social gatherings. And of course, our premier would be discussing with either regional leadership or with the mayors, and to make sure everybody was in concert on that. So it doesn't surprise me that York might be considering that, and we haven't ruled it in or out yet. It's just that their numbers have not yet been as significant as the others, but that has been rising up over the last week or so, and we're watching that very carefully, as we would do with other regions. And we know that our medical officers throughout the province, even at some represented at our public health measures table, had wondered whether we should make that a restriction on a province-wide basis, even with areas that hadn't seen high numbers. And I understand the reason for that, because the risk-taking behavior of large gatherings without precautions, because we've always said along, if you have 100 outdoor or 50 indoor, you're supposed to be doing the distancing. You're supposed to be wearing the mask. You're supposed to be handling that properly. And they've seen a number of cases, even areas that have hardly any cases, have become quite casual. And that means that it gives you a risk exposure that could be there if someone happened to show up, even if you've been in an area that's had no case for a long time. So as I said, nothing stops their medical officer saying, we still recommend you reduce your numbers more, but if we're going to have it combined with what we're putting out on a provincial basis, which includes enforcement and fines, that's a fairly significant step. But our public health measures table is going to be reviewing that in concert with the local medical officer of health and, of course, the government in consultation with the mayors or regional council leadership to have those recommendations and consultation prior to proceeding. So the 3 is a start. It'd be nice if we didn't have to go beyond that, but I don't rule out that we would have to go beyond that.
Follow-up, and this is the last question.
Thank you. My follow-up question to you is, how effective do you think these caps will actually be? The data suggests that really they're only able to trace about 50% of the actual cases' origins. So do you really think that these are the majority of all new cases when really you only know about where half of them are even coming from?
So you used the word caps and then you went to cases. So I think what you're looking at there is that the cases we've identified, do we have the epi links? That means, do we know where they got it from? And what we're finding that there's some people, and we have to look at our electronic systems, if you have a COVID app that said you're exposed and you went and got tested and it was a case, and you say, exactly where did you get it from? They say, I'm not totally sure. And now we have to make sure we can record it as it's a COVID ad alert. That's all we know. So some of those non-epi-linked cases may actually have different levels of application as we bring this new technology in. So we're trying to assess where all those epi-linked or non-epi-linked cases are from. It doesn't mean we don't know exactly where they're from. The person may say, I can't recall any real risk situation. I don't know a case that I was in contact with. I did get tested because I had heard something, but I haven't gotten definite. So what's the person's memory of where they were the last 14 days? That's a big request. Some people can't remember what they did 2 or 3 days ago. So we're trying to investigate to get that number down and how we can ascertain that better. So I think if you're mixing up with what we're doing with the new limitation on the events, the limitation on the events is the risk behavior, not the case positivity. So as I said before, there are some medical officers concerned that areas where they've had no cases for quite a while, if they're seeing large gatherings of over 100 people or 50 people in locations and no one's masking, no one's distancing, to them that's as concerning if they had the cases. So it's the risk behavior we're trying to bend down on. That's where the Premier wants to go and the Minister, and that's where I want to go to say, because we've had events, we've had cases related to that, but that doesn't mean we're only moving in where there's cases identified. We're moving in because the behavior's wrong and it's against our public health measures and practices. So there are 2 different things there. So the cases without non-epi linked, we're looking into that. The behavior related to the group and social gatherings, that's a risk behavior we want halted and stopped, especially in those areas there.
Thanks, everyone.
Thank you.